Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for, and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit, and don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. It's easy from the perspective of a doctor to tell a patient that they require surgery. But when you are the one being told that you need to have surgery, it's hard. It's difficult because, first of all, even being told that you are ill is difficult enough. And then to hear that you need to have surgery for treatment, it can trigger a lot of fears and anxiety and apprehension. So to help us understand what we need to know so that things are easier in the event that surgery is needed to save either our lives or the life of a loved one, I'm going to be discussing with a colleague of mine who is a specialist in this field. I know him, but you don't. So I'm going to let him introduce himself. So could you please tell us who you are and what you do?
Good afternoon, all. My name is Michael Hussein Banaya, the General Surgeon with Federal Medical Center.
So welcome to the Diabetes Care Summit. I'll start right away. What are the common things that diabetic patients present with that makes them have to have surgery? What makes them need surgery?
Well, the diabetic patients, like any other patient, can present with the common things every other person can present with, requiring surgery. So they can present with conditions that are related to the diabetic condition, complications of the diabetes. The common things are you need to have an appendectomy done, that's the removal of an appendix. You may need a myomectomy, fibroid surgery. They need to have lumps excised, lipomas, breast lumps, or repair of hernias. Those are common things any other person presents. Diabetics too can present with. Or they can present with a complication of diabetes, things like gangrene. That's when you have part of the body, particularly in diabetes, dying, and therefore needing an amputation. So these are the common things that diabetics need. Surgical conditions that diabetics present.
Thank you so much. So they can. Okay.
They can also present with acute abdominal condition, like any other person. I mentioned appendicitis earlier on, typhoid perforation, perforated respiratory ulcer disease. So these are things that you can prevent.
Okay. So they can present with the same things that any other person that is not diabetic can present with, either conditions in the stomach or what we doctors will say abdomen, and then things that are related to being diabetic or things that result from diabetes. Okay, so when a patient requires surgery, is there 100% guarantee that the surgery will treat the condition and afterwards everything will go back to normal? The person will be, it's everything is okay. There is no change after surgery. Does that happen?
There is no guarantee. In as much as surgeons would love to have that guarantee for every patient, it's not possible. A lot of factors can be within the surgeon's control. There are things you can do to improve and increase that the chances of the surgical operation is 100%. But there are things that are outside the surgeon's control. But by and large, no surgeon can give you a 100% guarantee for any procedure. Complications can arise that from the anesthesia, the medications you give before the surgery, or the surgical procedure itself. You may finish the surgery successfully and you may fail to heal, or get infected, and all that. So there's hardly any 100% guarantee. But with minor surgeries, you know that likelihood is closer. You're closer to 100%. It's a minor procedure, an elective, and when it's an emergency or a major procedure.
Okay, so there is no 100% guarantee for any surgery because you cannot predict anything can happen at any time. So the role of the surgeon is to try and reduce those things happening so that at the end of the day, the surgeon is happy and the patient is happy. Okay, so does this apply also to diabetic patients when they require surgery? There is no 100% guarantee.
Yes, there's no 100% guarantee for diabetes, but there's more. Their risk is increased. It's increased as a result of the fact that they're diabetics, and therefore the surgeon will have to deal with that diabetic condition, the complications that may have arisen from that diabetes, which may not be related to the surgery, but there are complications that will have a serious impact on that surgery. So the risk of surgery is increased in diabetics, even though it can be safe if the patient and the surgeon are aware of that and control it before the surgery. However, but the risk compared to the non-diabetic population is increased for the diabetic.
Okay, so you answered the next. That was the next question I was going to ask you, whether diabetics are at higher risk when they require surgery than people that do not have diabetes. So what can diabetes patients do to reduce this risk in case they require surgery?
Yeah, the first thing is the information. As a diabetic, you need to know that your sugar level has to be controlled before any surgical procedure. If you have a long time good diabetic control, then your chances of the risks, actually any risk, surgical risk, as a result of the diabetes is reduced. Wound healing is improved. You need to know what the type of drug you're taking for your diabetes, because you're going to provide that information to your surgeon, who is going to factor it into the preparation for your surgery. You also you need to ask your surgeon questions. You need to know the surgery you are going in for and the risks involved. Elective, is there an elective procedure? Is it an emergency? And all that. So, yeah, there are things you can do. These are things you can do. Control your diabetes, ensure that you have a good control anytime and every time. That will improve the outcome of the surgical procedure.
Okay, so just to recap, they need to know their drugs. They need to have a good control. And then they need to know what what kind of surgery they are going in for. Is it an elective surgery or an emergency surgery? So what's the difference between an elective surgery and an emergency surgery?
What an elective surgery or surgical condition is the one that is not immediately life-threatening. It means that the doctor and the patient can decide and plan, you know, for when it's convenient for both of them so that they'll have the surgery. So there's no immediate life-threatening. It's not an immediately life-threatening condition. But for emergency, it has conditions in which you need to intervene. Otherwise, it's danger to life or limb or any part of the body.
Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. Okay, so what can family members do to help diabetic patients when they are having surgery? Because in Africa, we don't come as one, we come as a family when we come to the hospital.
Yeah, a lot of times if the patient is presenting with an emergency and is not in a position to give information, you have to depend on the family members to provide that information about the diabetic status in the first place, the degree of control, and what the patient is taking for that treatment of the diabetes. Um, then the information regarding the disease condition the patient is presenting. Those are information that the family can provide. Now, they also family can support treatment, surgical procedures, or patients presenting with surgery. It's a very stressful moment for the patient. That means that they need that support and the information the doctor is going to give. Sometimes patient is under distress, and the surgeon or the doctor is giving a lot of information that he expects the patient to remember, which sometimes can be very difficult. So with the family around, they get to hear the instructions being given. Okay, you have to take your drugs at a short time, or you have to omit this particular drug, or you do this or don't do that. So the information and everything, the family, whichever family member is there, will help in doing that.
So what you've said a lot, and it means that for any patient who is diabetic, they need at least one family member that knows what is going on almost at every point in time. So the family member knows that they are diabetic. The family member knows how they are controlling the condition, whether they are doing it well or not. They help them, encourage them when they feel down so that they can do that. They know their drugs, the drugs the person is taking, because from what you've said, if it's an emergency and the patient can't talk, it's the family member that will provide that information. And then after the surgery, there are still instructions you give to the patient that the patient might not be in a condition to adhere to or to understand. And it's the family member that is going to help with that. So the family has
Role
a
to play.
huge role to play. And that's just goes to show that if a family has problems and they have issues, it will affect the health of a diabetic patient, because he won't, or he or she then will not have the support that they need to cater for themselves, not just with emergencies. Okay. So what questions should the patient or the family member ask before any surgery?
Okay. They need to know the type of surgery and
The
why.
type of surgery, okay. First
Why?
of all, the type and why the surgery is required.
Yeah.
Okay.
The surgery, is it, like we said earlier, is it an emergency surgery? Is it elective? Like I said, if it's elective, that means you have the time to plan. And if the diabetes is not controlled, you want to control that first. You need to have your surgeon the questions in preparation for surgery. What's my sugar level today? They need to know that, what's the state of my kidney, renal function, what's the electrolyte level like. These are all factors that will contribute to the outcome of the surgical procedure. So they need to know that, and they need to know what the surgery be done today. Can we? Yeah,
Okay.
if it's something that we need to, there's a need to control something or correct something. Is it something that we can? Is it a condition that we can wait and correct that one first, or do we have to find a balance somewhere? So yeah, we have to ask a lot of questions.
Okay, so how can, we've talked about the family members already, but generally now, not just, how can patients and family members help the surgeon to give them the best care possible?
Sorry?
How can patients and family members help the surgeon to give them the best care? What's making that noise?
Not from here.
Can you hear me now?
Yeah, I can hear you. I can hear
Okay,
you.
so what can patients and family members do to help a surgeon give them the best care?
One is information. They need
All
to
the
provide the,
information. Okay.
yes,
So they shouldn't
yes,
hide any information.
no, they shouldn't. The diabetic status of the patient, for how long he's been taking his drug, controlled or not, uh, any other condition that may be related to the diabetes, like hypertension, any renal disease, renal pathology, the doctor needs to know. The drugs, the type of medication is being used to control is diabetes, oral hypoglycemics, insulin. The doctor needs to know. And then they have to pay attention to the instructions the doctor has to give in preparation for the surgery, instructions after the surgery. Uh, Once that is done, the outcome of the surgery will be improved.
It's
The
better.
risk, any risk is minimized.
Okay, so they should not come afraid if they are taking other medications, even if they are traditional medications or they are medications that are not prescribed from the hospital, they should let you know so that if it's going to interfere with whatever you're doing, you can.
Yes.
Okay. So is there any other thing you would like to say to patients with diabetes regarding their care?
Yes. We understand that surgery or the announcement of surgery that you are going to have surgery can be scary. And just said that doctors and surgeons cannot give a 100% guarantee. Yet, with adequate information about your treatment of diabetes, about the choice of drugs, we can plan and ensure that we make this surgery as safe as possible. Minimize the risk of complications, wound healing, infection after the surgery. Once the surgeon knows and the sugar level is controlled, any organ damage is corrected or factored in during the treatment, the outcome of surgery can be very good, even for diabetes.
Thank you so very much. So we've heard it all. The surgeon is not a magician. It is the information that he is
Yeah.
giving that will determine how much he knows and what he can do for the patient. And for patients going for surgery who are diabetic, there are two things being controlled: the diabetes and the surgery. So the patient, the family members, the doctor, the surgeon all have to come together for the goal of preserving the patient's life. It's a team effort. So thank you so much, Dr. Micah. Thank you.
Thank
Thank
you.
I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos because there's still lots of information that will be really beneficial to you. Don't forget soil.web.app. Download it now. See you in the next video. Bye.